The Royal Brompton won its reputation as a respiratory hospital long before it made the excellent advances in heart surgery. I spoke to some of the staff coming off duty the other night. They keenly pointed out to me that the Royal Brompton Hospital is the #1 heart and respiratory hospital in Europe. We have ECMO machines, for God's sake. I asked what that was. They pointed out it's the last chance saloon if you have COVID-19. The machine takes the blood out of the body, reoxygenates it, and then puts it back in the body. The Royal Brompton is a centre of excellence for treating COVID patients. When the other hospitals in London can't do any more, they're sent to the Brompton. The hospital may have lost its dispensation for providing child heart paediatrics, but it should be restored as a COVID centre of excellence. Have other options been explored? Well, yes, they have. And we all know about it. A move to White City, how much did that consultation cost? A move to Paddington Basin, 15 million on that consultation. And now this move to St Thomas's. It seems to me the only options that are ever considered is a move away from Chelsea. I wonder why that is. Why are the properties standing empty, ready to be sold to the highest bidder, when we have nurses who currently work on the front line of the COVID response at the Brompton are having to travel home at a 12-hour shift to Finchley? All the support and the legacy wishes sold off to the highest bidder instead of providing accommodation for our key workers? Or is the case that they're good enough to save lives, not good enough to live in Chelsea, as those properties are too expensive for them? I was speaking to a frontline nurse the other day who broke down when I spoke to her. She just finished a 13-hour shift, only to be sent a letter claiming that the CEO had sent the staff a letter as they're beginning the first formal step in the journey to join Guy's and St Thomas's, and that the proposal will mean a change of employer, and that there would be a TULO meeting this Friday to discuss the new contract at St Thomas's. She said, Ian, how are we supposed to go from saving lives in a super intense environment with many deaths to dealing with a corporate merger? It's not British and it's not on. Is the CEO, Bob Bell, not aware that we're in the midst of a major respiratory pandemic? The mismanagement of the Royal Brompton Trust and its medical assets must be laid firmly at the door of the Chief Executive, Bob Bell. What Chief Executive allows trust land to be rented for private car parking spaces at the end of Sydney Street when the Royal Marsden is having to park units in Park Parade for medical screening? What Chief Executive announces the building of a new highly expensive diagnostic unit, which is welcome, then announcing the hospital will move in 10 years? You just can't make it up. I attempted to contact Bob about 18 months ago. Somebody wanted to make a £50 million donation. He didn't even get back to me. Why would a chief executive show no interest in a donation that could improve hospital facilities on unused hospital land that could improve the long-term legacy on the site? Why is the billion in assets held by the Royal Brompton charity not being utilised to support the hospital staff and in terms of accommodation, or indeed to make this a new centre of excellence? Is it the case that this body's been set up with the assets of the original hospital trust merely to protect the pension fund of previous executives instead of supporting our frontline staff? We need an audit of all the assets of the Royal Brompton Trust that have been sold or transferred and those that still exist. We need to understand the role of the Royal Brompton charity and an audit of all the assets that were transferred to and held by the charity, and for what reason, why they were transferred, and are they actually following the rules of the bequest? We need 10 Downing Street to step in here and call for an investigation by way of a commission with a number of stakeholders, not just the Board of Trust, who, in my opinion, have an extremely blinkered view as to what should happen. Those stakeholders need to include residents. We're calling for a public inquiry into the mismanagement of the asset and the medical facility that is the Royal Brompton Hospital, with the staff of the Royal Brompton to be interviewed without recourse due to allegations of bullying and intimidation from senior management. We're calling for the same public inquiry to investigate the merger between St Thomas's and also the viability of formalising the relationship between the Marsden and the Trust. We don't want more NHS land being turned into luxury housing, which will see the DNA of the architecture of Chelsea turned into a mini Manhattan. We need excellent respiratory hospitals at this time and not a plan that sells them off. What message does that send to the 40,000 or so families who've lost a loved one due to the pandemic? It sends the message to the people of London and the United Kingdom that pandemic or no pandemic, that we don't really care about a hospital that is the forefront of saving lives. This council leadership must urge Boris Johnson and his government to take back control and show the country that the shutdown of the #1 respiratory hospital in the country is unacceptable at this time of national crisis, and it can start by removing Bob Bell from his position and set up a public inquiry into this merger and a future formal Chelsea and Fulham medical hub with the Royal Brompton, Royal Marsden and Chelsea and Westminster's hospitals. I ask you to pass the motion. Thank you.
Thank you very much.